Welcome to yet another episode of Health Nuggets. Now, the medical condition that we will be looking at today is said to be a silent killer by the World Health Organization. The reason being, many people do not know their numbers when it comes to blood pressure. Hypertension is the topic that we will be looking at today. It is said by the World Health Organization that it is the leading cause of premature deaths, not just here in Kenya, but worldwide. My name is Aida Muzatsi. Health Nuggets starts now. So as mentioned, we are looking at hypertension, and we are coming to you from Heart Rhythm Medical Center right here in South Sea, and I'm glad to be joined by a cardiologist and heart specialist, that is Dr. Daniel Ndwiga. Daktari,
thank you so much.
I won't say karibu, I'll say thank you for hosting us.
Thank you so much.
All right, now just looking at our topic of discussion tonight, what do we mean when we say hypertension or high blood pressure? What exactly do we mean, and what are we looking at?
High blood pressure basically means persistently elevated blood pressures. The world norm is 140/90. So this is pressure that has been taken twice or thrice, or pressure taken once in the presence of some effects on the body that can be related or attributed to the elevated blood pressure. It is not a good thing because elevated blood pressure is known to damage the organs, principally the eyes, the heart, the kidneys, the brain, and the blood vessels and nerves throughout the body. And so it is an urgency that when the blood pressure is persistently elevated or elevated in the presence of one of these signs, it's addressed as soon as possible.
Okay, now when we talk of hypertension, definitely we are looking at someone's numbers when it comes to blood pressure. You just mentioned 140 and 90. So what do these numbers mean, and when can you say that probably my blood sugars are too high or my blood sugars are too low?
Okay, talking about blood pressure. Basically, we assess blood pressure using a blood pressure machine. This is one of them, and this is another. This one is generally most likely to be found in hospitals, where this can actually be available for you at home to use. So the blood pressure measurements are based upon the cardiac cycle. That means the heartbeat. So when the heart contracts, you get the first reading known as the systolic reading, which is usually higher because you're sending blood under pressure into the blood vessels, which are these pipes that go through the body, starting from the heart through to the body. The pipes start from there and go that way. So the heart contracts, sends blood forcefully, gives you the higher reading known as the systolic. When the heart relaxes, so it can fill blood from the lungs. That's called diastole. So you get a higher reading or an upper reading and a lower reading. Now these readings, we generally, for everybody, want blood pressures less than 140/90. We have stricter guidelines for when you are younger, or if you have other diseases such as diabetes, we actually want your blood pressure even lower.
Okay, now probably we can do just to help in indicating the numbers. I don't know if you'll do it on me.
Definitely, yeah, definitely.
Yeah.
So basically, we like for the blood pressure to be taken in the upper arm. Can be the left or the right. Sometimes we prefer to go for your dominant arm. Either if this is tight, it's going to raise your pressure. It's going to raise your pressure, but we will account for it.
All right.
Yes. So there's always a part here that says artery. The part that says artery must be aligned with the inner aspect of your arm. Yeah, because that's where the artery that you're going to be using is set.
So, a question, you're supposed to do it not on top of a cloth. Let me say that's why.
Sometimes we do when it's a very light cloth.
Okay.
It must be loose fitting clothing.
Okay.
This one of Ida is not loose.
Too tight.
It's not really tight, so it might affect our reading.
Okay.
So the client really should have, or you should have been sitting down for at least 5 minutes. You should not be talking, so you have to stop talking now. Not have recently drunk coffee or tea, maybe in the last 30 minutes. Rest quietly for 5-10 minutes, then we check the blood pressure. So you're going to proceed to do the same right now. And the machine is checking your pressure. Oh, either your blood pressure is that of a child, 107/74, with a heart rate of 83. You must be very healthy.
Oh, thank
This
you.
is good. Then I remove the cuff from you. Generally, we recommend more than one reading. One reading may not be enough. We recommend that we take 2 or 3 readings over intervals before we make up our minds. But starting off so well, we may not require to do any more readings.
All right. Now, talking of you doing the test, that is more than one time. Does this happen probably to someone that their blood pressure is too high, so that you have to do a number of them for you now to help with the diagnosis?
If your pressure is, we actually stage blood pressure. We have a stage 1, stage 2, stage 3, stage 4. We also have classes for blood pressure. So there are some blood pressure readings that we call borderline or mildly elevated. Those we actually check repeatedly. If your blood pressure is severely elevated, or if there are signs of what is known as end organ damage, that means the body is actually already feeling the effects of the blood pressure and is showing signs and symptoms of blood pressure effects. We don't even wait, we treat immediately. But if your pressure was to be found to be about 155 over 100, for instance, the first time, we may not be in a hurry to treat you unless you're showing effects of the blood pressure on your body.
All right. Now, my numbers were?
107 over 73 with a heart rate of 83.
All right. And you mentioned it's 140?
Over 90, less than 140 over 90.
Less than, not exactly 140.
We want you less than 140 over 90.
All right. I don't know if we can probably just use the hospital one for as you also help in just explaining to our audience.
So this is known as an aneroid BP machine. It's a bit bulky to use in the house, so we have it here because we end up having many good reasons to want to check the pressure severally or continually. So you're going to do the same thing again. So this is a bit technical because you can't do it on your own. You require help. Because apart from the BP machine, you require someone to actually use the stethoscope to actually get your BP reading. So you're going to be looking at the dial here and see where your BP actually rests at. So you can see this is very manual.
Yeah.
So I'm checking the blood pressure now, looking for the systolic blood pressure. Even lower, Ida, 100 over 60. Even lower, so that's really, really good.
Oh.
You're very healthy by all respects.
So whatever I'm doing, I should continue doing or not doing.
You're doing well. At least with respect to the blood pressure, you're doing very well, Ida.
Okay.
Congratulations.
Thank you so much. All right. Now, just now getting back to the interview. I just mentioned over whatever I'm doing or whatever I'm not doing, let me just continue doing that. Let us look at the risk factors. What can make, that is my blood sugar to be so high or so low, or just to tamper with the numbers as you put them?
Blood pressure is a composite of several things. There are some physics formulas that we put in to talk about what causes blood pressure. They are well known, but it's based upon the heart itself, its strength, the amount of blood that fills the heart. It's based upon the speed at which the heart beats. It's based upon how the tone of your blood vessels. But this is what causes blood pressure rise. There are some factors we call the non-modifiable risk factors. These are factors that are intrinsic to the particular client you're dealing with. We're talking about the age of the client. We're talking about the race of the client. You know, are we black? Are we Hispanic? Are we Asian? Are we European or Caucasian? We're talking about the gender of the client, so that men are at higher risk of high blood pressure development than women. We're talking about the family history or the genetic makeup of the client, so that if you have first degree relatives, these are father, mother, brother, sister, same father, same mother with high blood pressure, there's a higher risk of someone developing high blood pressure. Then there are what is known as the modifiable risk factors. These are things that are really within our control. We talk about weight, we talk about salt intake, we talk about smoking history, whether someone smokes and how much they smoke. We talk about alcohol intake, the type of alcohol and how much they take. We talk about exercise, whether someone is exercising or not. We talk about cholesterol, if someone has high cholesterol. We talk about stress, is someone very stressed, are they handling it well? We talk about sleep, is someone sleeping well or not? We talk about something known as hormones. There are sometimes hormones that change and cause higher risk of high blood pressure. For instance, women are generally at a lower risk of developing high blood pressure until they attain menopause. That's when the levels of testosterone in their system actually rise and cause higher risk of high blood pressure.
Right. Now, talking about women, let me look at pregnancy. Yes. Can pregnancy probably just lead to changing your numbers? Yes.
So what happens in pregnancy is for every pregnant lady, we find that the body changes quite a bit in favor of the baby, not in favor of the mother. Okay. So there are a few things that change that can actually put the mother at risk of developing what is known as pregnancy-induced hypertension. So blood pressure that comes during pregnancy. Unfortunately, if this is not addressed, sometimes it becomes established blood pressure in these particular clients. So for one, the blood volume in a pregnant lady increases by about 40%. That means if you had 6 liters to start with, you probably get about 8 liters. By the time pregnancy is proceeding on. The client increases weight. The client gets increased salt and water retention. Then an organ called the placenta, which produces hormones to sustain the pregnancy, produces so many chemicals, they actually do affect the vascular tone for the lady and can cause high blood pressure. So it's quite a known thing that blood pressure tends to rise during pregnancy. For a few clients, we know that it actually dips during pregnancy.
Okay, you also mentioned of hormones. Let me say, I mean a few or a number of women are on contraceptives or just different family planning methods. And we have definitely, they tend to, can I say, is it tamper with our hormones as women? How does that, or how does contraceptives or family planning methods now just relate with high blood pressure or blood pressure?
Yes. So family planning methods basically is that we tamper with the reproductive cycle. Instead of allowing the normal ebb and flow of the hormones during the reproductive cycle for a lady, we raise one particular set of hormones that make it impossible to ovulate. So these hormones usually are estrogen and progesterone. So high levels of these hormones are higher than normal. Even as they interfere with ovulation, they also have an effect of retaining water, retaining salt, which raises blood pressure.
All right. Now, the World Health Organization refers to hypertension as a silent killer. Let us look at the signs. Probably, I know not so many people can actually just have this particular machine right here at home to get to know their numbers. But what are some of the signs? What are the signs or the things that I start experiencing for me to know that my blood pressure is not so okay? Yes.
By and large, most clients don't even know they have high blood pressure, unfortunately. But if you find yourself fatigued, for some reason you wake up in the morning and you don't have the energy to take on that day, it is possible your blood pressure could be elevated. If you feel your heart beating, we're not really supposed to feel our heart beating. Awareness of heartbeat, also known as palpitations, is a sign that maybe your blood pressure could be elevated. If you get dizzy, blurring of vision, dizziness, that could indicate your blood pressure is elevated. If you have headaches, that could also be blood pressure that's elevated. If you get a bit short of breath, that could be elevated blood pressure. Swelling of the legs could be elevated blood pressure. Inability to rest and sleep can also be elevated blood pressure. So it's a whole series of different signs and symptoms that tell us that please, you need to know your numbers. Just go into any pharmacy or clinic or hospital or specialists like ourselves, allow us to check your blood pressure.
Okay, and you've just talked of, let me talk of vision blurriness. That is also a sign of diabetes.
Yes, it is.
How do I differentiate that probably this is as a result of my blood sugar and not blood pressure?
Thankfully, you have a lot of signs that we spoke about, because if I would digress a little bit towards diabetes, blurring of vision is important for diabetes, but so is excessive thirst, excessive eating, excessive passing of urine, and general body weakness. Signs of diabetes are not as many as signs of blood pressure. Blood pressure gives us many more warning signs.
All right, and you also mentioned of the causes. And you mentioned that hypertension can end up probably just affecting a number of organs in your body. What are the organs that can be affected? And just looking at diabetes as well, probably, and I've seen many patients of diabetes, of people living with diabetes, also end up having hypertension. What's the science behind it, or what's the reason behind it?
Yes. So first and foremost, the same risk factors that apply to diabetes apply to high blood pressure. They are much more clearly defined for blood pressure, but even so, the same signs and symptoms occur with diabetes. There is what can I say? Constellation is the word we use of signs and symptoms that have been dubbed in medicine as Syndrome X. Syndrome X happens to the middle-aged, young to middle-aged. So that we have central obesity, we have pot bellies, our waistline has increased. For the ladies, more than 35 inches, for the men, more than 40 inches. We are sedentary, we don't work out, we don't exercise. And our weight is really above 90 kilograms for the average sized African man or woman. When that happens, in comes in high blood pressure, in comes in diabetes, in comes in high cholesterol, in comes in high uric acid. So you find a constellation of diseases that happen on a person at the same time. So unfortunately, the same client is diagnosed with high blood pressure and diabetes at the same time.
And let me talk of medication that this particular patient that has diabetes is taking. Can they probably end up raising their blood sugar? And for someone that has, let me say, hypertension, how can they manage their hypertension as well as managing their diabetes?
The same principles apply to diabetes as they do to blood pressure, because you find that what you eat, how you eat, does affect both and can affect them in the same way. So that in diabetes, we actually are very keen on what you eat in terms of how many carbohydrates you eat, how frequently you eat, and the volume. So that we're actually quite keen on limiting the carbohydrates, limiting the sugars. For blood pressure, it's almost purely salt related. We want you to address the salt.
Welcome to PCEA Abundant Hope Academy in Eldoret for primary section grade 1 to grade 6 and junior secondary grade 7. We have boarding facilities and we offer transport too. Interviews are currently ongoing. PCEA Abundant Hope Academy is located in Eldoret, opposite Rift Valley Bottlers along Mifugo Street, PO Box 863-30-100 Eldoret. For more information, please call us on 0725 666 512 or 0722 698 693. This is where your child should be. Welcome.
Well, welcome back. We are looking at hypertension on this episode of Health and Nuggets. And so once again, we are coming to you from the Heart Rhythm Medical Center. And I'm with Dr. Daniel Ndwiga, who is a cardiologist as well as a heart specialist. Now, Dr. for someone that is just joining us right now, someone that missed probably the first part of the interview, maybe just a recap of what we've talked about in terms of the numbers most importantly. Yes.
So today we are discussing high blood pressure, which unfortunately is the most common lifestyle diseases we have worldwide, but also in our part of the country. The prevalence is really increasing. So that we find that adults above the age of 40 in some of the urban areas, prevalence of high blood pressure is about 30 to 40%, unfortunately. So that's really a big concern. This means that the blood pressure, as measured using a BP machine, is elevated above 140/90. We discuss systolic blood pressure being the reading we get when the heart muscle contracts and forces blood through the blood vessels. So that reading must not be above 140 millimeters of mercury. or the diastolic means, and then the heart relaxes, and that force diminishes, should not be above 90. And this is important because blood pressure has an effect on the body organs, and blood pressure actually has an effect on how long someone lives. So that it's been discovered that for every 10 millimeter rise in blood pressure, people are actually losing even up to about 15 years of their life. So that it's important that we control blood pressure, we live longer, more quality lives that are not hospital and illness bound.
All right, thank you for that. Now I'm not so sure if we touched this one during the first part, but how many tests do you do for you to say this particular person has hypertension, and immediately you diagnose someone with hypertension? What are the next steps?
We generally recommend that at least 2 or 3 readings be taken for the same client. The client should have come in and rested we normally recommend between 10 and 15 minutes resting. When the blood pressure reading is being taken, you must not be talking, and you must not have taken coffee or tea or any other stimulant in the 30 minutes prior to that reading. Home reading is actually more accurate than hospital readings, but you have to come to hospital. We might want to check your pressure over 2 or 3 days. There is an exception to that. If you come to us, your blood pressure is very high and you have symptoms, severe headache, blurring of vision, dizziness, your heart is beating very fast, or when you do our tests, we discover that actually some organs are actually going into what is known as dysfunction or illness, we should treat you immediately and not wait for a few other readings.
And now from then, once now someone has been told that they have hypertension, as a doctor, what are some of the things that you now start the journey with this particular patient that has been diagnosed with hypertension?
I will sit with the client and I'll do a thorough interview. I'm very interested with what we had mentioned earlier, the risk factors for this client. We have the non-modifiable. I want to know their age. I want to know are they male or female. I can see what their race is, but I want to know about their family history. I'll go on ahead and I want to find out about their lifestyle. What do they do for a living? Do they exercise? I want to know in terms of measurements. What was their BP reading? What was their height? What was their weight? Because that gives me the body mass index, and I can see if they're in the healthy range or they're not. I want to know, do they smoke? Do they take alcohol? How much salt do they put in their food? I want to know their family history of high blood pressure, heart disease, kidney disease. All that is important to me. Have they been hospitalized before? Have they undergone any surgeries? All that gives me an idea what I'm dealing with, so that when I do formulate a work plan for the client, it is all encompassing and it is thorough.
And how does the treatment plan now looks like?
So it always has 2 prongs. The first prong is medication. We start with medication because if you need medication, it means that your blood pressure is high enough to cause organ dysfunction, organ damage. So within about 2 weeks to aim to have controlled your blood pressure from whatever value it was to less than 40/90. So that's a major aim of medication within about 2 weeks, sometimes to a month, but 2 weeks is what we aim for. Then you have a longer plan, which is addressing your particular risk factors. What is it that has precipitated this blood pressure to actually rise? That would involve looking at your blood, looking at your heart, assessing your body in terms of the body organs. We see if there's any culprit in your body system, any culprit among your hormones. Do you have high cholesterol? Are your kidneys working well? Is there an infection? Is there malaria, for instance, that could have caused this blood pressure to rise? And address these issues that are particular to you that could have sustained or caused the blood pressure.
Okay, and now when it comes to the medications that you're giving this particular client, let me say, will they be on these medications for lifetime, or is hypertension treatable? Is it something that probably I'll take my medications, then I'll come and you'll be like, your numbers are now okay, you can go back to your life? Or how exactly does the management bit of it go about?
This is very individualized, but in general, a few principles do apply. If you've had blood pressure for more than 5 years, it is a little unlikely we'll be able to get you off medication. When you're older than 40, it becomes a little bit more difficult for us to get you off drugs. Because when you're younger than 40, generally, by and large, the blood vessels are much more pliable. Well, above 40, they begin to be more set because of a process known as atherosclerosis. So if you come to us, you're younger than 40, when the blood pressure first starts, you've not had blood pressure for more than 5 years, we are able to control it. If you find a modifiable risk factor that we can address, for instance, you're overweight, you're taking too much alcohol, you're smoking, you're adding a lot of salt in your food, you're not sleeping well, you're extremely stressed, or your hormones are actually abnormal. All of these things are reversible, and we're happy to reverse them so that you can be restored to a normal life. When you start on medication, generally we do a month to 3 months. Personally, I do 3 months.
Okay.
Then I try and wean off the drugs. Sometimes I can't wean off the drugs because I realize the blood pressure keeps rising, and I try to do that. So maintain you on as low dose as possible to maintain your health.
So by weaning, you mean like reducing the dosage, or?
You got it. We don't just start and stop. This is because it's a lifestyle disease. It developed over the last 3 months usually. It's not something that started yesterday or the day before yesterday. It's been slowly creeping up on you through your lifestyle. So you actually also have to address that lifestyle as you try and wean off the medication.
All right. Now looking at the numbers, quite a number of people have hypertension, and they do not know that they are living with this particular condition. What would you tell Kenyans, or what would you tell them in terms of just managing and just knowing your numbers?
So first and foremost, we would encourage everybody, especially if you are above the age of 40, but now we're bringing it down to the above the age of 30, and even to the ones who are 25 and above. Please get your blood pressure checked at least once a year. If you're above the age of 40, we recommend once every 3 months, please get your blood pressure checked. It's useful. Confirm what your blood pressure is. If there's any abnormality with it, please go back for 2 or 3 days, let them check your blood pressure. If there is a family history of blood pressure in your family, or someone has had heart disease or kidney disease or has had a stroke, please, we recommend that you actually get checked more sooner, more frequently, even if you're only 30. We recommend at least, if you're 30, once in 6 months, if you're 40, once every 3 months, if there's a family history of the above. If you've had high blood pressure, please check once a month. We encourage that strongly. Then if you do have a family history of these illnesses, or your pressure has been high, please take lifestyle measures to actually ward off the onset of these things. Simply because it's been there in your family doesn't mean it's actually going to come and affect you. The effect of blood pressure is dependent upon you, what choices you make. If you choose to exercise, to maintain a good diet, to stop smoking, to reduce on your alcohol intake, to manage stress, to sleep well, you most likely will be able to evade high blood pressure or very high blood pressure or the effects of blood pressure. So that whatever would have come upon you is either ameliorated or eliminated completely because of the choices you choose to make.
Okay, and now for someone that already has hypertension, what would be your word to them? Someone that already has, probably they've had it for quite some time. You're no longer like reducing their dosage, their dosage. What can you tell them so that they are also managing their numbers? Or what you've dealt with a number of patients. What do many patients do wrong? Yeah.
For one, our clients generally choose to stop taking the medication to see what's going to happen. That doesn't work. We prefer that you work with us to wean you off the drugs. We also encourage you to not just take medication blindly, allow us to work with you, to partner with you, because it's a partnership, being a lifestyle disease, to assess you, see what the risk factors could be, see what effects the blood pressure has actually had on you, and address those. Many times if you have more than one illness and we address one completely, the other one also responds. So allow us to work with you, allow us to give you medication that has the least possible side effects for you, and we actually encourage you to adhere to your medication. When you have concerns or doubts, please raise them. Let us find a way through. In particular, point to raise is ladies who had pregnancy-induced hypertension. We strongly encourage that those work alongside their physician or cardiologist together with their gynae to make sure the pregnancies are actually stress-free. Because blood pressure in pregnancy actually frequently kills the baby and puts the mother at risk also.
All right. Now, talking of that, I'll just have to take you back because of you've talked of pregnancy-induced hypertension. I'll take you back to the family planning and contraceptives. Now, before someone is probably told you'll be using this particular contraceptive or family planning, some of the things that are taken are usually their blood pressure. What's the reason, or what's the reason behind that?
Quite frequently when you go into a family planning clinic, they will want to know who you are, what is your age, how many children you have, what was the circumstances in that time during your pregnancies. They want to know, do you have high blood pressure history? They check your blood pressure that day. Do you have varicose veins? Do you have family history of varicose veins?
Yeah.
All of these are talking about the blood vessels and the possible effect of the family planning pills or injections on your blood vessels. Because you know that when you do take the hormonal contraceptives, they are known to actually raise the blood pressure through an indirect mechanism. That is by causing increased salt and water intake because they're actually hormones. So that has been known to cause blood pressure in a number of women. So that's an important thing that must be done as you prepare or as you choose a family planning method.
All right, thank you so much for that. Now I'll just want you to give probably our audience just your final words as far as hypertension is concerned.
Thank you so much, Ida, for this opportunity. I appreciate being able to address our audience and encourage them to know your numbers. Please get your blood pressure checked this year. If you are above the age of 30, once a year, once every 6 months may be sufficient. If you're above the age of 40, please once every 3 months is sufficient. If there's anybody in your family who has high blood pressure, or has had heart disease, kidney disease, or has had a stroke, or if you yourself have had a high blood pressure reading done, it's important to begin to institute measures to protect yourself. Please let us all exercise as much as you possibly can. By that, I don't necessarily mean going to the gym. I encourage you to pant and sweat 150 minutes a week, preferably with some incline or resistance to exercise. We encourage you to stop smoking. We encourage you to reduce your alcohol intake. We encourage you to minimally take minimal salt or stop adding salt to your food. We encourage you to sleep sufficiently and to manage your stress, because these are the things that are actually causing problems to our population. If possible, we encourage you to lose weight, because weight does attract a lot of these things to come into our lives. Otherwise, a healthier nation is a building nation, to be a prosperous nation, and that's our desire.
Wow, thank you so much, Daktari, for that. I don't know if there's anything I can add, but asante sana for your time, and thank you so much for hosting us as well. All right, that was Dr. Daniel Ndwiga, who is a cardiologist as well as a heart specialist. And remember, we were coming to you from the Heart Rhythm Medical Center, where we were just having our show and just looking at hypertension or high blood pressure. If you're just joining us, remember you can always just go back and get to learn of what exactly we have been looking at. As Daktari puts it, you are supposed to be healthy. Well, thank you so much for tuning in, but just a reminder, the most important thing is for you to know your numbers as far as our blood sugar is concerned. Thank you for tuning in. My name is Ida Muzatsi. Until next time, your health matters.